I think we have nothing against transparency. Thank you. We have nothing against transparency, I believe, but we're very concerned about the way this is communicated. And you said, Paweł, educate. I think that it would be easier to educate if we communicate correctly towards the public. And for the moment today, we've spoken only about the disclosure. We never spoke about how we're going to present that. And I think that it's not only, we spoke about the transfer of value, that's what you said, and I said that already before to Richard. What I have the impression is that it is a transfer of bad reputation on the back of the doctors. And that is my concern. And when you want to involve the stakeholders, it is certainly important for the communication building. Your plan?
And that's why this is launched today, because we'll have viewers on the web. We intend to make this meeting and the forthcoming conversation known to, if not 3 million healthcare professionals, to a lot of them, particularly to the great number of associations here in Brussels. I can't count how many organizations there are. And we have at the national level all these associations. So we are beginning this now, also in response to the conversation we've had, Michel, with the Biomed Alliance, with other groups here in Brussels, to really try and go beyond the Brussels bubble, because we've talked about this, but we need to go much beyond that. And that's why we're resorting to the new technologies with social media and everything else, and we're having people like Duane Schultes who's pulled this together. Thank you, Duane, and Gary here helping us. So indeed, this is just the beginning. This is not the odd event where we're going to talk about this, and we need to start addressing at the national level, where the disclosure will be done, how to frame this. And we can learn from the countries that have been represented here today about how you work in partnership, in preparing the press, you can have different types of platforms, as we've talked about this before, that there's a possibility even for the medical associations themselves to do the actual disclosure based on information they're given by the companies. Or the employers, big university hospitals could say, we're going to have the disclosure here, where we can disclose this in the context of clinical research, CME, everything else we're doing. And of course, that's much better to contextualize it than it's on a corporate website from a pharma company.